evening to one and all. I, Dr. Rasavri Sawant, on behalf of IHW Council, welcome you all to yet another series on breast cancer awareness. This series is specially powered by Dr. Reddy's and is on the mission of the Be the Better Half campaign, and is an initiative of Integrated Health and Wellbeing Council. So, as we are commemorating the Breast Cancer Awareness Month, which is October, we have very eminent panelists here with us to talk on a very interesting topic, a very pertinent topic for breast cancer, which is pink ribbons and strong women, elevating breast cancer awareness and prevention. And to talk in detail on the same, I welcome Dr. Bhavesh Poladia, who is medical oncologist with Thangam Hospital, Namakkal. Sir, thank you so much for joining. We welcome you to the show. I welcome Dr. Rajesh Bolam, who is consultant medical oncologist with Yashoda Hospital, Sikandrabad. Sir, welcome to the show. Thank you so much for joining. We welcome Dr. Praveen A., who is consultant medical oncologist with Apollo Hospital, Hyderabad. Sir, thank you so much for joining. We're so glad to have you with us. I also welcome Dr. J. Sujana, who is consultant medical oncologist with American Oncology Institute, Guntur. Ma'am, thank you so much for joining. So glad to have you on the show. So with that, with all our panelists here with us today, let us start with the discussion. My first question is to Dr. Bhavesh. Sir, as we are talking about breast cancer, we would want to know from you that, what are the prevalence that you see of breast cancer amongst all other cancers that you observe? How high is the number? You can share specifics if if available for your region, or if not, for the entire country that you observe in your practice. Sir, can you please unmute yourself? Yes.
Good evening. I hope I'm audible.
Yes, sir, you're perfectly audible. Please go
Thank you. So thank you for the invite and thank you for the question. I think the October month is about breast cancer awareness, and the basic reason why the breast cancer awareness is so important is because the prevalence, as you were asking, is very, very high. So breast cancer is considered to be the most common cancer for women, not only worldwide, but also in India. So most of the, if you ask any of the doctors who are practicing cancer, they'll tell you that breast cancer is one of the most common cancer in their practice, and it will almost include anywhere between 30 to 50% of their patients who are going to suffer with this disease. So, and mainly it is a problem of females, the ladies. Hardly 1%, less than 1% patient are going to be males. So it is a problem mainly for the females, and the number is increasing every year actually. And with more urbanization, the further increase in the numbers are happening even in urban cities as well as in rural areas. So the number is so alarming that awareness has become the most important issue, where we can make people aware about it, general public, so that they and their loved ones can do self breast examination or clinical breast examination by a proper physician. And last but not the least, the mammogram, which will detect the cancers at an early stage, and it can be cured, because we know that most of the cancers which are detected in early stage, like stage 1, 2, they are almost curable. In stage 3, it is curable after a little extra treatment. So there are good hopes which are there, and with every coming year, there are more advances which are happening, in which even stage 4 cancers patients with breast are living for many, many years and with good quality of life. So I'll end my answer here. Thank you.
Thank you so much, Dr. Bhavesh. I will take the following question from Dr. Praveen. Sir, can you please help the audience understand what are the early signs and symptoms for breast cancer, so that they are available, so that they are aware And if any of the signs they see in their family members or themselves, they can come to the doctor and get checked. Yes, sir.
Hi. One of the most and common symptom of breast cancer is the lump in the breast. So whenever the woman is examining herself or doing her routine bath or everything, when she notices a small lump in the breast, I think they shouldn't ignore. It is the most common symptom, and they should get it checked by their gynecologist or physician or anyone. So one of the other most important point is almost 80 to 85% of the lumps are swelling in the breast, which we see in women of age 20 to 45 active menstrual cycle period, are not cancerous. That is the most important thing they got to remember, because we see other things like lipomas, fibroadenomas, and fibroadenosis, and various benign breast problems also we see, especially in this age group. But we need to confirm that with biopsy. So that is the most important thing. Whenever they see any lump in the breast, they shouldn't panic. They should get it checked. So lump in the breast is the most common symptom of carcinoma of breast, and it is also seen in various benign breast problems also. Along with it, if the disease progresses or it advances in size, we also see small swellings in the armpit along with the breast, and we also see nipple discharge or something like that, or discharge from the lump in the breast. So these are the most common symptoms that we see in a breast cancer patient. If at all the disease is advanced and it has spread to other organs like lungs or anything or liver, we see symptoms like cough, or if it's spread to the brain, headache or jaundice, that we see in a later stage. So, but our focus should be on detecting the cancer at an early stage. As told by Dr. Bhavesh, breast cancer is the most common malignancy in women, especially in India and worldwide also. And it is one of the curable cancer, especially if we diagnose it at an early stage. We see a lot of women who are diagnosed with cancer, 1 hour breast cancer, are living their life normally, preserving their breast. That is the most important thing we want to spread this message. Breast cancer doesn't mean removal of the entire breast. If we remove the tumor, conserving or preserving the rest of the breast, that is sufficient. So lump in the breast is the most common symptom.
Thank you so
One
much.
more thing, one more small thing I want to tell is, we should also focus on the family history of breast cancer. Whenever we are seeing a patient, nowadays with advanced molecular testing, we are seeing more and more hereditary breast cancer patients. So if any woman is diagnosed with the breast cancer, we should ask the family history. If at all that family history is there, we need to take special precautions and special screening recommendations for them.
Yes, sir. We will be discussing about the familial history of breast cancer and other gynecological cancers also in this episode in further details later on. Thank you so much for giving us the points as to, how to detect the signs and symptoms early. Thank you so much. My next question is to Dr. Rajesh. Sir, we would like to know what are the risk factors that lead to the development of breast cancer, as we have been hearing that there are two types of risk factors. One that are in your control, in the patient's control, lifestyle, habits, etc. And the other one is like family history, etc. So can you please help our audience understand what these are and what is the difference between the two?
Thank you. Thanks for the invite, and it's a wonderful question. One need to understand the risk factors, then only they can prevent it. The risk factors, as you rightly said, are of two types. One are modifiable risk factors, one are non-modifiable risk factors. The most important non-modifiable risk factors is being female itself. The most common risk factor for a breast cancer is female sex. Then apart from the the other non-modifiable risk factors would be like genetics. We see majority of the times these breast cancers run in family, though the incidence hereditary of breast cancers to a tune of around 5 to 10%. Majority of the times they may not be able to give the family history. But if you are seeing a young woman or a triple negative breast cancer or a patient with a bilateral breast cancer, it's always mandatory to have a genetic testing done. So female sex, increasing age, genetic history, family history of breast cancer, and history of previous breast lesions. Like sometimes you might have a atypical ductal hyperplasia, a condition which in future can lead to breast cancer. So these are few of the non-modifiable risk factors for the breast cancer. Coming to the modifiable risk factors which are in our hands are like increasing obesity, lifestyle changes like smoking, alcohol. Because of the urbanization, more and more women are being having a habits of smoking and alcohol, and obesity, physical inactivity, sedentary lifestyle. These are few of the avoidable risk factors. In order to reduce the incidence of breast cancer, then the things which are in our hand is to have a healthy weight, maintain a physical activity, control the obesity, and avoidance of smoking and alcohol. These are few of the modifiable risk factors one could think of to reduce the incidence of breast cancer.
Thank you so much, Dr. Rajesh. We will come back to you with few more queries later on as to different, points that people believe that also can be risk factors. But I will come back to you later on. But before that, I will take...
The other risk factors which I forgot to mention were early menarche, late menopause, age at which the first child born, and inadequate breastfeeding. These are also a few of the risk factors.
Okay, sir. We will come back to you again in some time. Before that, I have a question for Dr. Sujana. So, ma'am, thank you so much for joining and being the female participant in our panel. And as we are talking about breast cancer and the more prevalence is seen amongst women, not saying that it does not occur in men, but majority of the patients are women. So, thank you so much for being a part of this panel discussion. My question to you would talk about the different aspects, not just physical and technical content related, but also the psychosocial, mental and emotional aspects that goes around when a woman is detected with breast cancer. So, ma'am, as any woman is detected with breast cancer, they have this intrinsic fear, or even when it is not detected, even when they are just suspecting of a lump in their breast, they get so fearful and so anxious that most of the times these women try to avoid the entire topic and subject and not even come to the doctor to see. So can you please talk a little more about that? How have you observed, if you have observed the same in your practice, and what would be the advice that you would want to give to such women so that more and more people do not feel afraid to come forward and get the initial screening done? Over to you. Ma'am, you're on mute.
Yeah, thank you. So the psychosocial factor of fear, as you rightly mentioned, is really a great concern factor, because of which the breast cancer cases present in a very late stage. Even though they feel that lump for the past 1 year or 2 years, they keep neglecting it and use some alternative medicines and come to us with such a bad shape of the breast lump and the lesion. It will progress to stage 3 and stage 4. It becomes inoperable. And sometimes it metastasizes also very fast in aggressive cancers. So if they had approached the clinician at an earlier stage, whenever they felt a lump, which was increasing in size and not responding, so if they had presented earlier, they would be in a better shape, and the treatment outcomes will also matter. So once they overcome the fear, they'll be presenting in the early stage. There'll be good treatment outcomes, and moreover, the family on which family which is dependent on the women, the children who are dependent on her, are going to be the most beneficial, including the patient itself. Because I see a lot of 20, 30 years old female breast cancer patients with just 2 to 3 years old children, or 6 years, 10 years, and they come crying to the clinic that they have neglected it for a large period of time. They should have come earlier.
Thank you so much, ma'am, for putting out the word and also making people more aware that, to come and see a gynecologist, an oncologist, or a specialist, doctor, to even if they detect any little lumps or, breast cancer signs. Thank you so much. My next question is to Dr. Praveen. Sir, we would like to know what are the different methods of screening and diagnosis that are available, and some of the most easily used methods that we can advocate right now, so that people are made aware of what are available, and if they are suspecting breast cancer in themselves or their family members, they can advise on that.
Yeah, as rightly told by Dr. Sujana, we see nowadays a lot of breast cancer in young patients. So that may be due to as told by Dr. Rajesh, maybe due to the urbanization, change in the diet habits, and change in the way the things are there, early menarche, late menopause, and lack of breastfeeding and everything. They are leading to increasing the incidence of the breast cancer. The only one thing to win over breast cancer is early detection. Early detection is by screening. Screening can be done in 3 ways. First is the basic thing, as we can suggest a woman or advise a woman and guide them, is by self-breast examination. Self-breast examination is a small thing. The woman herself can examine her own breast. They can keep one single day in every month of their cycle, every one particular day in after their cycle, 3 or 4 days after that cycle menses, and they can examine herself. And if they find anything abnormal, immediately they can come to the physician and or gynecologist and get it checked. That is the examination by the doctor. And if at all any abnormality is there, it will be followed by screening mammogram. Screening mammogram is a specific test that was advised by various organizations, and they have issued guidelines that after 40 years of age, every woman should undergo screening mammogram once in every 2 years, so that as age increases, the risk of breast cancer increases. So that they have various studies and trials have shown that screening mammogram have definitely reduced the mortality rate associated with breast cancer. So after 40 years of age, it is definitely advised for every once in 2 years for a woman. In some guidelines, they say after 45, but we say in India, we see many cancers a decade earlier. So after 40 years of age, it is definitely advised for a woman to undergo screening mammogram. One more thing in this, if there is a family history, if the patient has a family history and they were diagnosed to have some specific mutations that are leading to breast cancer, this screening mammogram and MRI will be done at a much earlier age. Like they'll be started at the first diagnosis age, maybe after 15 or 20 years, and they'll be overlapping with 1 year mammogram and 6 months MRI. So screening mammogram is the one thing they should remember. With the advanced mammogrammy and this 3D and tomo and everything, we are able to pick up even a small lumps that are, those are 1 centimeter, 1.5 and 0.5 centimeter also in the breast. Even though they can't feel the swelling outside, if the lump is there in the inside, in the deep in the breast tissue, we can able to pick up those small lumps also. And we can, if we diagnose them early, we can definitely cure them, those small lumps, definitely by removing them. As I told you, let us not fear and let us not assume that every lump in the breast is cancer. It is not. But we need to get it diagnosed with a proper testing like a biopsy. We don't do FNACs like needle test, we should do biopsy. So mammogram is a test that needs to be, every woman should undergo after 40 years. One more thing is, like, if we don't do mammography in test right away, we do sonography, that is ultrasound. If we find anything abnormal, then we'll try to correlate with mammography and we try to follow it up with the biopsy. So self-breast examination, as you asked, is the easiest thing that a woman can herself examine her own breast and find anything, can come to a physician. If the woman is greater than 40 years of age, screening mammogram is the test, and definitely they should undergo screening mammogram test.
Thank you so much, Dr. Praveen. I will take the following question from Dr. Bhavesh. Sir, so as we have been discussing that, in India, so many women are detected with breast cancer, mostly at the later stages. So can you please help us understand, is it the same scenario in Western countries as well? Or is the prevalence and the, of breast cancer portrayed differently in India?
Thank you for that question. And it is actually very alarming to know that in India, unfortunately, we have less awareness. The awareness is going on from many years, and slowly the scenario is changing. And because of the breast cancer awareness, now we are trying to find. Now we are getting patients with very small lumps also. Initially, it was very rare thing to get a small lump, but now it is quite common to get a small lump because of the breast cancer awareness, which is happening every time, every year, and every even the physicians are trying to take opportunistic screening when the patients are coming and the relatives are there. We even counsel the relatives what Dr. Prem has suggested. Praveen has suggested that we even take even relatives, we counsel that okay, this is your age and this is your risk. You can try to undergo screening, and if anything is there, we can try to treat, and it will be curable at an early stage. Compared to West, where the cancer awareness is much better than our Indian population, so there usually they present in very early stage, and that is how their cure rates are higher than ours. But soon the scenario is changing very fast, and we are also trying to get more small cancers because of the awareness. And I think the as the I think in next 1 decade or more, 1 decade or 1.5 decade, we will see the change in such a way that most cancers what we are going to see in our clinics are going to be screen detected or self detected, and they are going to be smaller. Thank you.
Thank you so much, Dr. Bhavesh. I will take the next question from Dr. Rajesh. Sir, yes. Sir, can you please help us understand that, as Sir mentioned, that in India, this age that which breast cancer is detected is lesser than that of the Western countries. And nowadays, due to the awareness that is being spread around breast cancer, more and more people are getting detected at the earlier stages and getting cured. So can you please help us understand what are the different kinds of treatment options that are available for breast cancer? What is usually recommended when it comes to medical management of breast cancer, if there is anything like that?
Sorry, I just missed your last 1 minute question.
Can you please help us understand the medical management aspect of breast cancer?
Yeah.
If somebody is coming at an early stage, would it be possible to cure them completely without surgical interventions?
Yeah. So one thing, medical management of the breast cancer depends on the stage. As any cancer, the treatment depends on the stage, whether it is a localized tumor, locally advanced tumor, or a metastatic tumor. For a localized tumor or an upfront operable tumor, we do upfront surgery followed by chemotherapy based on the histopathological report. On the histopathological report, that is a biopsy report, we see the tumor size, lymph node status, and the hormone receptor status, IHC we call it as, ERPR, HER2, and then decide the adjuvant treatment. Whereas it in the locally advanced tumor, that is borderline operable or locally advanced tumor, we try to downgrade the tumor, downsize the tumor by giving prior chemotherapy. We call it as neoadjuvant chemotherapy. We make the tumor small and then perform the surgery, and post surgery based on the adjuvant, based on the histopathological report and IHC, we do the adjuvant chemotherapy. Coming to a metastatic disease, that is once which has gone beyond the breast to a distant organs, we call it as a metastatic disease. In this kind of patients, we usually give systemic therapy, may it be in the form of chemotherapy, hormone therapy, or immunotherapy based on the IHC testing. If it is a hormone receptor positive tumor, like ERPR positive tumor, we try to give hormone therapy until unless the patient is in visceral crisis. Suppose if it were to be a HER2 positive tumor, we give it targeted therapy plus chemotherapy. If it is a triple negative, that is all three are negative, like ERPR and HER2, we tend to give chemotherapy. Coming to your second part of the question, can we avoid the surgery? At this point of time, complete omission of surgery is not feasible. But as the science is progressing, we have reduced the intensity of surgery. Initially, we used to do radical mastectomies like Halsted. Later, we are trying to do modified radical mastectomy. Now we have moved to breast conservation surgery plus oncoplasty. Now, as of now, at this point of time, we are trying to preserve the axilla. Whenever you do a breast surgery, ideally we have to remove, initial concept was to remove all the 3 levels of lymph nodes. Now after the advent of sentinel lymph node biopsy, we are only removing the selected if the sentinel node is negative. So now that is the concept of complete axillary sparing if the tumor is very, very small and a good biology of tumor. To be more specific for your second point, at this point of time, we are not in a position to completely avoid the surgery for a breast, but the concept is we are trying to reduce the amount of the tissue removed, and as Dr. Praveen and Dr. Bhavesh sir has really said, we are trying to conserve breast as the more and more early breast cancers are detected.
Thank you so much, sir. My next question is to Dr. Sujana. Ma'am, can you please help us understand the different, this topic of familial history of breast cancer and how that impacts the screening and treatment protocols for anybody who has family history with gynecological cancers or breast cancers?
Yes. So around 10 to 20% of breast cancers are familial, that is, they run in the families. So out of these, 5 to 10% cases are due to the most common gene mutation seen in breast cancers, that is the BRCA1-2 gene, in which the familial history is positive. So the screening modalities also differ for these patients' families who have been detected with this mutation. Suppose if the patient is diagnosed with BRCA mutation, then the family, that is the daughters or their siblings, are being tested. So the first degree relatives. So when should they be tested? They should be tested at least 10 years earlier to the diagnosis of the person who has been diagnosed with cancer. Suppose a person A is diagnosed at 40 years with a cancer, then the screening of the family members should start at an earlier age if they are found to be BRCA mutation positive. Okay. And the screening modality, if it is before 40 years of age, the screening for BRCA mutation carriers is MRI, mammography, MRI of the breasts, not the routine typical mammo which is being done after 40 years. So this is the major difference in the screening protocols in those in which familial history of breast cancer. And in the rest 10% of the cases, we don't know which gene is being mutated. So the only thing is screen them earlier, 10 years earlier, before the diagnosis of the patient.
Thank you so much, ma'am. I have another question following this one from you. So many people who understand breast cancer and know a little bit about it or the family history aspect with breast cancer related to Angelina Jolie's case, as she being a very famous celebrity, and this topic being popularized by her to large media and masses. People are able to connect, but they really don't understand why she took that step and what all technicalities were entailed. So can you please explain us that scenario as an example so that people are more able to understand what happened and why is it very necessary to get screened if you're having any family history?
Yes. So breast cancer has been talked about a lot after Angelina Jolie has come out with this concept that she has undergone some surgeries prophylactically, that is to prevent cancer, because she has a very strong family history of cancer from her mother's side. A lot of familial members were affected, and she was detected to be BRCA mutation positive. So she was not diagnosed with any cancer, but she got her breasts removed prophylactically. That is so that she cannot develop the cancer in future, because her risk of developing the cancer in future is to the tune around if it is BRCA1 positive, the chances are around 50 to 60%. If BRCA2 mutation, it is around 40 to 50%. During the lifetime, she might develop breast cancer. So ideally, so we can prevent breast cancer in patients who are BRCA mutation positive once they complete their family, that is around 30, 35 years of age. They can undergo this prophylactic mastectomy or prophylactic removal of their ovaries, because removal of the ovaries also prevents ovarian cancer and also the breast cancer also. So breast cancer reduction in case of ovary removal surgeries is to the tune of 50 to 60%. Whereas for ovarian surgery, we can prevent it 100%. Whereas prophylactic mastectomy, the risk of breast cancer is reduced by 90 to 100%.
Thank you so much, ma'am. I will take the next question from Dr. Bhavesh. Sir, can you please talk about the breast cancer incidences in males? How common is that, and what are the signs, if they are any different from those of females? And is it entirely related to having family history with males? Or does a male can have breast cancer in his lifetime even when none of his family members had it?
Thank you for that question. And as we already discussed before, definitely it is very less in males. In males, it is just like 1%. So the ratio what we usually discuss is 1:99. So 99% of the time it is in the females. 1% you can see the male breast cancer. The presentation is usually the same. Only thing it is little more easier to find a lump in the chest region, in the breast region for males, because there is no big breast tissue and there are no deep-seated tumors. So it is comparatively little easier for male breast cancer to be detected. Effect or the treatment-wise, treatment is almost same. And most of the patients who are male breast cancer patient, they are hormone positive and HER2 negative. So this is one of the better type. If we see all the kinds of breast cancer, this is one of the better type of, or the best type of the variety. So I would say luckily males do not get the worst kind of variety. They usually get a little better kind of variety of breast cancer. Thank you.
Thank you so much, sir, for the comparison. But yes, it's pretty ironic to hear that you got the best kind of cancer and the worst kind of cancer. We would not wish for people to have that. And I would also wish that people hearing this awareness session and all the experts present here do have the courage and the motivation to get something checked. If they see any abnormal signs, symptoms, or any lumps which were not there before, to come forward and get it screened, because early screening definitely saves life. My next question is to Dr. Praveen. Sir, many of the people, many women have this myth floating around that certain types of bras can lead to breast cancer, or certain type of treatment such as breast implants, etc., can lead to development of breast cancer. So what is the science behind it? Can you help clear it out, if it is a myth, if it has any relevance around breast cancer?
Yeah, definitely certain type of breast means, like if there is any dense breast, it is difficult for a screen detected mammogram to pick up any lump in the breast. So nothing like any kind of breasts have more incidence of or increased risk of breast cancer, but it is a difficulty in picking up or screening detected breast cancer. In those dense breasts, we would like to go for an MRI when it is required for a screening. After doing mammo, if the mammo is inconclusive, we'll go for MRI. And definitely implants, there is some controversial data that says that any foreign body, because implant is a foreign body. Nowadays, with advanced implants, with silicone gel implants and everything, definitely implants may increase the risk of the breast cancer, but there is a data is controversial. But there is also data regarding OC pills that increase the risk of the breast cancer. But it was seen that longer usage of OC pills, it may increase the risk of the breast cancer, but it doesn't lead to increase in the risk of the mortality. So these are only myths. With usage of these OC pills, it doesn't increase the mortality of the breast cancer.
Thank you so much, Dr. Praveen. My next question is to Dr. Rajesh. Sir, can you please help us understand that many women believe that because they took oral contraceptive medications or, menstrual regulating medications in their lifetime, that's why they got breast cancer, or also injury to the breast aspect. So these two areas also women feel that, these might have caused breast cancer in their lifetime or to somebody that they know. So can you please help us understand if it is true, if it is a myth, and if there is science behind this?
To be very specific to your question, injury to the breast, we have got no data to prove that injury will cause a breast cancer. That is your second question. For the first question, as Dr. Praveen has clearly said, there is some data that combined OC pills would do cause, because as I said in the risk factors, anything which increases the level of estrogen, like early menarche, late menopause, nulliparity, the age at which first child is born, these all things technically lead to the increased estrogen level. The exposure of a woman to an increased estrogen level may be because of any reason, may it be an OC pill, inadequate breastfeeding, nulliparity, any reason which indirectly increases the estrogen levels, do have a direct correlation with the increase in incidence. But nowadays, people are using more progesterone only pills. Previously, they used to have a combined estrogen, combined pills, and a high dose they used to have. When it comes to the third generation OC pills, that is POP pills, technically the risk of developing a breast cancer from these progesterone only pills, I can say it is negligible. But if you are taking a older generation pills, that is a combined pill with high concentration of estrogen, then there is a chance. Because as I clearly said, increase in estrogen with respect to any cause is a direct cause, because it's a pro-mitotic.
Thank you so much, Dr. Rajesh. My next question is to Dr. Sujana. So, ma'am, there is also one aspect that is floated around breast cancer topic quite a lot. That is, women who never give birth or never breastfeed are more susceptible to developing breast cancer. And can you please help us understand why that happens, if it is true, and what would be your recommendations to the viewers that are watching?
Yes, women who never give birth, or they are called nulliparous. So they are at increased risk for breast cancer. The theory behind that is that they are exposed to more number of menstrual cycles. Whenever a person attains pregnancy, there is around 1 to 1.5 period of break in the menstrual cycles. So the breast tissue is less exposed to the hormones at that period of time, and the repair mechanisms and everything are intact. Whereas with longer exposure to the menstrual period and to the hormones, there is increased risk for breast cancer. Hence, nulliparity and never giving breastfeeding is also a risk factor for having this cancer.
Thank you so much, ma'am. My next question is to Dr. Bhavesh. So, sir, as we are talking about elevating breast cancer awareness and prevention, we talked about various different aspects on awareness. What are the signs, symptoms, risk factors, different methods of treatment that are available. But when it comes to elevating breast cancer care and prevention, there are many, different organizations that are working for integrating AI and ML and these latest technologies for cancer screening and detection. How do you see these being successful currently in practice? And also, do you see these having a future in, the oncology care for the patients? What are your thoughts on this?
Thank you for that question. And you rightly said that AI is actually entering into each and every space. So here, what I understand is something which is very pattern based. So like what we were talking about, screening mammograms. So there are certain specific characteristic what we see on the mammogram to suspect that whether these are going to be cancerous lesion. That is first thing. Second thing, when we take a biopsy, there is a specific pattern what we see in the histopathology slide, which tells us this is a cancerous lesion, which basically confirms that it's a cancerous lesion. So there are fixed pattern which we can actually take help of AI, and wherever there is very high number of patients which are coming, or a high number of individuals which are coming for a high number of females which are coming for screening, this is where it can help. So if there are fixed pattern which is fed into the AI, and different combinations of the same are being the learning process keeps developing, so they will exactly, in maybe near future, they'll try to exactly rule out, rather than manually seeing each and every mammogram, they will rule out which are going to be high risk and which are going to be absolutely normal. And only then those which are high risk can be seen further by a clinician and then take a call for biopsy. And second step will be, as I told you, once the biopsy is taken, slide is made, this can all be generated into a digital picture. And once the digital picture is fed into the AI, they will start the computer will start learning it, and then again it will be combination of all the high risk things which can be taken care of, and those which are very confident. Okay, these are high risk features and these are cancerous lesions. Only those will be seen by the clinicians. So this is how more number of individuals can be helped with less labor intense, and this is how probably AI can help. But I think beyond this, when the treatment part comes, I think it is still not easily computerized or made more like a conveyor belt. Thank you.
Thank you so much, Dr. Bhavesh. Similar question to Dr. Praveen, sir. We're talking about AI and ML and these latest technologies for cancer care and specifically breast cancer care. How do you see these coming at advantage for the future? What are your thoughts on the same? Would this be easily adaptable? Would it be too expensive? Or would it be very technically sensitive? What are your thoughts?
Yeah, as rightly told by Dr. Bhavesh, AI is coming in a big way in this medical fraternity and field also. But nothing can replace the role of the clinician, because even though we feed all data into the system, even though it gives us that this patient requires this treatment and everything regarding the treatment part. So ultimately, that the clinician has to decide which patient should receive which treatment accordingly. And many times we got to go according to the patient preference also. And that empathy part will also be lacking in that AI thing. So definitely there is a lot of scope is there. But for our country, and it will take some time when we are treating patients at grassroots level and suburbs, towns and everything. It will take some time. Ultimately, nothing is going to take away the role of the physician. Ultimately, tissue diagnosis is a must, even though imaging comes and everything. And surgery is the only thing that can cure the breast cancer. And other treatments like modalities like medical treatment and radiation are helping the surgical treatment to prevent the risk of the and decrease the risk of the breast cancer.
Thank you so much, Dr. Praveen. My next question is to Dr. Rajesh. Sir, oncology is advancing every day. I am sure you guys are having to, are seeing these latest and greatest interventions every other day in this space. So as we are talking about precision oncology and predictive oncology being the future of oncology, as it is, said, how can, you feel this AI and ML and integration of these machine learning, artificial intelligence technologies, engineering and science both help greatly in the predictive oncology aspect, where we can predict cancers before even happening and take measures to avoid them. What are your thoughts on the same? Would this be a reality in near future, or do we still have a long way to go and focus on awareness and these basic aspects which are still lacking? What are your thoughts on the same?
To be specifically pinpoint answer, yes, there is a long way to go. I feel we have to focus more on the cost-effective methods like awareness, basic screening, mammogram at the age of 40, and work more on it. Because there are few studies which say that there could be a chance of evidence of tumor coming up in future, or if you can detect few of the CTCs in a completely asymptomatic female, is there any chance that it might come in future? So we have not come to a position definitely to say that AI can predict these are the candidates who can have a cancer in future. But we do have a old method, time tested one, which says like Gale risk model, what we call it as, based on the few of the factors, 4 factors like previous history of breast biopsies, number of family members affecting with the cancer, or person who has already affected with the breast cancer, or any genetic risk factors which are present. So we can predict with this, by using this Gale model, as to who are the candidates who have a high risk of developing cancer. That is based on the based on the history. But there's not such a device or a mechanism by using AI to predict the cancer. But the other way is like there are few tests and thing which will predict like the chance of recurrence, wherein which by using a genetic few of the gene testing like oncotype DX, mama print and all, I cannot say directly exactly AI, but with the information available that these genes are present or if these risk factors are present, then the chance of the breast cancer coming back, the recurrence is high. So whenever we wanted to avoid chemotherapy in few patients, because few of the patients would be fearful of the side effects. So if an elderly female or a elderly female with a low tumor size, like a 1 centimeter tumor, who is not having nodes, and if the histopathology is ERPR positive, meaning clinically, if we feel the chance of breast cancer recurrence is low. In these kind of patients, by using these tests like oncotype DX and mama print and these kind of few genetic signature tests, we can avoid the chemotherapy. This is now established way, but there's no such test to predict who are the patients who are going to get a breast cancer in future.
Thank you so much, Dr. Rajesh. My next question is to Dr. Sujana. So, ma'am, as Dr. Rajesh mentioned, and our other specialist also mentioned, that there is a wide, necessity of spreading more and more awareness around cancers and breast cancer, and also screening a wider population for the same before we try focusing on various other futuristic aspects. So, what do you feel if we are giving this compulsory screening aspect to every woman, basically in mid 30s and 40s, as that is the time where breast cancers start arising in Indian population? Would you feel that this screening everybody on a large scale, mass scale, would be practical for a country like India, where we have such a lot of population? Or how to go about this so that we are able to catch people early, regardless they show up to screening centers themselves or not, just like a mandatory fashion? Would this be a practical good idea? What are your thoughts around the same?
So the guidelines sound very easy, but in practicality, it is very difficult to implement. So once there is a screening program, people don't turn up. Some of them are busy and some don't think I might not get, and some maybe due to fear, they don't turn up. So because of that fear factor, that awareness factor, and the logistic issues involved, and the mass screening effect of mammography is not an easy task for any institute also to get it done. It's all about whoever is coming into the contact of a clinician, be it a physician or any surgeon or anything. So everyone should be aware, and they should advise that these cancers are being common nowadays from the 40 years of age. The screening tests are available. So sensitizing people by using this October as a breast cancer awareness month. So one breast cancer patient can educate the surrounding population around her in her locality about the breast cancer age, and they can prevent it. And even the patients can motivate the other common people to get it done. So we can use that things to increase the screening modalities of mammogram. Especially the mammogram is the thing runs around that mammogram is a very painful procedure. So we should comfort the person also that even though it is going to be painful for a little point of time, but it is necessary to prevent any wrong images or motion artifacts, so that we can precisely interpret the radiograph or the film and get a proper report.
Thank you so much, Dr. Sujana. My next question.
Dr. Sawant, can I add a bit?
Yes, sir. Please.
Yeah. I think we are spending so much of budget on health, as we are making immunization schedule during childhood and pediatric age group as compulsory. And I think we should make screening tests, especially for cervical cancer and breast cancer, like mammogram and pap smear test, as a national agenda, because these two cancers are the proven that we can decrease the mortality by picking them up early, and we can completely cure them also if we pick up them early. I think we should also spread more awareness by government programs. We are seeing a lot of programs, even though when we go to movie also regarding tobacco cessation and everything, ads come up. I think there is a lot of phobia, as Dr. Sujana said, like the mammogram may be painful. There is a lot of social myths are there, and for women to come out, especially in rural areas, for screening test is also difficult. I think we should spread this message, especially from government side also, with more publicity, stressing on that screening test. And nowadays we see a lot of medical colleges in everywhere. The number of medical colleges are also increasing. To have a small mammogram is not so difficult. So I think it should be more come from government side also regarding educating the public, so that can be done in a large scale. Nowadays you are seeing regarding tobacco cessation and everything coming in a large scale into entire part of the country. I think this should become also like this as a immunization schedule. I think this also should come as this screening, especially for pap smear tests and mammogram, should come in a big scale, especially both from the health fraternity side and government side also.
Very well said, sir, Dr. Praveen. And adding to the same point, also advocating for a special program specifically for cancer, as currently cancer comes under the non-communicable diseases programs, and there is no separate focus on cancer in the country as a whole, as an individual entity. So also advocating for that is required, I feel, because as the breast cancer rates are increasing every year amongst women in India, special focus on these aspects that you've highlighted, and also some different aspects which we will discuss in the last minutes of the discussion that are remaining. So on the same note, my next question is to Dr. Bhavesh. Sir, as ma'am said, that interpretation of mammogram also varies. So what are your thoughts on focusing on the infrastructure and the skills and expertise of the clinicians? We're not talking about oncologists who are trained in reading mammograms, etc., but the technical staff that is there at district hospitals, community hospitals, etc., and making them more equipped with the means and the sources to interpret mammograms and these reports, technical reports, more accurately. What are your thoughts on the same, on the infrastructure and the manpower side for cancer detection and care?
Thank you. Thank you for that question. And this is exactly what we discussed initially, that now everything can be digitalized. So the mammogram part, especially what we are talking about. So technicians will get the mammogram done properly. So that is how we can teach them how to get a mammogram done. So once they have done the mammogram, this image can be digitalized and it can be sent any part of the India or world. So the reporting part has to be done by a proper breast radiologist who is trained to see all these images. So rather than percolating this to the healthcare staff at PHC level is going to be very, very difficult, because you have to have almost 10 to 15 years of rigorous training to understand, to see how this mammogram is, what are the specifications, what are high risk features, what are low risk features, which should undergo further testing. So it is a very, very difficult task. People actually put 10, 15 years to understand that, and very difficult to make it in a nutshell, to make understand at a grassroots level. So what we can do is train them how to get the mammogram done properly. And once the mammogram is done, that digital image can be sent to a specific doctor who is specializing in breast radiology, and they can report it. So this reporting can be done at a center which is a central center, and all the peripheral center can just push their images to the central center. So this is how it can be done. And I think slowly people are actually doing this also at a very far off places, periphery, where the doctors cannot go there or doctors are not available. Those people are trained to get the mammogram done and send the digitalized image to the center hospital. Thank you.
Thank you so much, Dr. Bhavesh. My next question is to Dr. Bolam Rajesh. Dr. Rajesh, sir, as we are talking about different aspects that need attention in oncology care, one of the major hindrances for people to come up and get screened, get tested, get the treatment is finances. As they feel, and in reality as well, cancer therapy and cancer treatments, cancer medications are very expensive for an average, working working class person. So, and in this aspect comes the aspect of health insurances. So how do you feel is the uptake of health insurance in oncology space amongst your patients that you see, and are there any gaps in this health insurance aspect for oncology that need to be looked at by insurance companies, by the government, by people themselves? What are your thoughts?
It's a wonderful question, off the beat topic, but it is very pertinent to the Indian context, especially when the people pay out of the pockets, not like UK where it is completely been borne by the cost is borne by the government. One of the important aspects, as Dr. Praveen was saying, that screening should be made mandatory. Similarly, insurance should be made mandatory. So you cannot drive a car without buying an insurance. So we have, when we made sure that the rule has come, just to drive a car on the road, you need to have a insurance, and it is a punishable offense if you don't have. But when you care for your vehicle so much, why not for the human health? And if you see the amount of money which is spent on the amount of the percentage of GDP which is spent on the health is very less when compared to the other countries. When we are paying such a high, huge taxes, I would, maybe it's an offbeat discussion, but I would request the government to have at least the screening tests, which are a subsidized thing. That is one of the things which can be done. Or at the government centers, it should be available at the free of cost, at least the screening. Because if you see the amount of cost of treatment involved, especially in an advanced stage, is much higher than for a screening test. So with the by providing the funds for one patient who is a HER2 positive breast cancer for a period of 1 year, or if it is a metastatic disease for a period of 4 or 5 years, however, how much ever long the patient lives. With that finance, if you can streamline and make sure at least in a high risk population, if you can screen it, then we can reduce. Coming to a second question proper, health insurance, I think it is a it should be made mandatory. And I find few of the lacunae in the health insurances, especially in the oncology. One thing, once they get detected, majority of the insurances exclude the cancer patients. That is one thing. So by taking more premium also, if they could be made this one, if they could include the cancer, then it would be more important. More and more private companies, and in fact, if not private companies, at least the government initiated companies should take this up and give more insurances to the cancer patient. Second thing, what the challenges we face commonly is few of the life-saving medications or even if it is a life-saving medication, suppose if it were to be oral medication, majority of the times these insurances do not cover. They make it mandatory that it should be an injectable, it should, and insurances cover only for a IV medication if they are hospitalized for 24 hours. So that thing has to be removed. Which drug has to be covered, yes or no, should be a matter of concern from the doctor, not the insurance policy maker. Or at least they should involve a oncologist or a specialist before upfrontly rejecting, is it a life-saving medication, yes or no. And with the latest advances, more and more immunotherapy medications are coming up. So majority of the insurances are not covering the full immunotherapy. They say that this is not covered, only chemotherapy is covered. So there are some situations wherein which you cannot give chemotherapy either because of the disease nature, like malignant melanoma, it's a kind of skin cancer. Or there are some situations wherein because of the patient's physical fitness, you cannot give. In those situations, even if somebody has immunotherapy, even if somebody has finances, few of the insurances companies are not giving. So omitting few of the important life-saving therapies just because they are orals, or putting a cap on particular drugs, like we will be giving only 20% or 30%, because we do have some of the patients who have got 1 crore insurance, like 10 lakhs base policy with 90 lakhs top up. Even then, few of the insurance companies deny, saying that this immunotherapy is not covered, this orals is not covered. So we need to bring 3 changes. One, including the oncology, like cancer patients also into the insurance first. Second, even if they are diagnosed and if they wanted to include, take high premium and then involve into it. And including all types of treatment, including oral, subcutaneous, IV, So there should not be a hindrance, like whether it's a tablet or subcutaneous. Before we could think that, especially if the insurance, because these patients' treatments are all costly. So that should be, if they are affordable, they should be borne by the insurance things. I think these four to 5 points that a government body in collaboration with the private insurances should consider, especially when treating a cancer patients.
Thank you so much, sir. With that,
Dr.
we come
Pawan,
down to
yeah,
the
one point.
yes, sir.
I think Dr. Rajesh told a very important and thought-provoking point, which is true. We are giving more importance to a vehicle than our body. See, like whenever we are buying a vehicle, insurance is a must. Similarly, when a human is born, we can distinguish there itself. The person comes under BPL category or not BPL category. If the patient comes under BPL category, almost all states are giving good treatments free of cost for the BPL category. If the patient doesn't, the person doesn't come under the child is but run under BPL category, I think they should make it a must to have insurance. That is, people should get educated that they should have an insurance at the time of taking birth certificate itself. That is a must, right? So slowly everything will follow. And the most important points told by Dr. Rajesh sir, most of the things are not covered. I think every one of us in the panel must be facing the same thing. Some of the drugs are covered, some of the drugs are not covered, tablets are covered, others are not covered. We are facing the same thing. I think that health insurance should be made by must for all the individuals in the country. It is not being made must because of the various issues in the country and various other problems. We all know that. But I think people should get motivated and they should give more importance to their health than other material things. And if the patient comes under BPL category, anyone will go to a government setup and will take their treatment. So, but if not BPL category, I think health insurance is a must. Sorry for interrupting in between.
No, sir, definitely. You shared a lot very valid points, Dr. Rajesh also.
I think
And
they should issue health birth certificate after taking insurance, just like they issue the registration. Why not?
Yes, sir, definitely. And I feel such
Most of the
protocols. Yes, and we completely agree with you. We feel such protocols are important so that more and more people take the seriousness of this aspect, and more organizations, more banking organizations come up with insurances that are also more applicable to the real world scenarios.
And
real
I'm telling you, all the onco treatments are covered free of cost for the BPL category in almost all the states. Even under Ayushman Bharat also, most of the, some of the especially targeted therapies are being covered. In most of the states, and targeted therapies are being covered in for BPL category in free of cost. The problem comes with the middle class people, like our and everything. So we don't go to that BPL category. We don't have that insurance and everything. I think that awareness should be there among the people. When a child is born itself, I think they should be motivated enough to take that health insurance. At least insurance is there. Some of the costs will be covered up, and they don't have that fear that if something happens to me, along with the life insurance, I think health insurance is also a must for all.
Definitely, sir. Very rightly pointed out. All the discussions that we had in this episode on various aspects around breast cancer were very pertinent to elevating the breast cancer awareness and prevention awareness, not just in the fact of breast cancer, what it is, who gets affected, but also awareness in the sense that how can you get treated, how can you avail the best care, access to care, and also how what provisions are available from the government side for you to reach your optimum health and get free from breast cancer. So thank you so much to all our panelists as we are down to the very end of this discussion. Very insightful, very informative discussion. Thank you so much, Dr. Bhavesh Poladia, Dr. Rajesh Bolam, Dr. Praveen Adusumili, and Dr. Surjana Joka for taking out time from your busy schedule and imparting us with wealth of knowledge on this topic around breast cancer. Thank you. We would also like to thank Dr. Reddy for this brilliant initiative on raising breast cancer awareness, Be the Better Half campaign. Thank you so much. And we would also like to thank all our viewers for staying with us till the very end. I hope this episode gave you a well-rounded picture as to what cancer is and the different aspects around cancer awareness and prevention. Thank you so much. With that, we sign off now. Stay happy, stay healthy. Bye-bye.